Toffer, I'm one of the nurses. I've been looking after Mrs. Bother here. She's come in with some kind of problems with the urine, but she's not really been passing much today. I think she's only passed like 20 mils in the past 2 hours. I'm just a little bit worried about her. She doesn't seem herself. She seems more confused. I'm just a bit worried. Oh, my dear. What's going on, my love?
Can I have a look at the computer?
You're at the hospital, my dear. You've been here for a couple of days now.
Where's my daughter?
I think she's coming a bit later. She's coming a little bit later. The doctors are just here to come have a chat. Is that okay?
I suppose so.
Okay.
I'm just going to talk to the patient really quickly after. Can I get a set of obs?
Yeah, I can get that ready for
You
you.
know what antibiotic she's on for the UTI?
Not off of the top of my head, but it should be on the notes.
Okay, alright.
I'm gonna go walk the dog.
What's the patient's name again?
Beaver Bother. Beaver Bother.
Beaver.
Yeah.
Hello, Beaver.
Hello, love, who are you?
My name's Marty. I'm one of the doctors.
Oh,
I heard you've not been feeling yourself.
Can I pop this on your
Is that right?
no. I'm at the doctor's, aren't I?
Yeah, you're in the hospital.
I'm at the doctor's. I need to go to walk the dog.
Okay, before you do that, can I ask you, are you in any pain?
It's my back. My back's hurting.
Your back's hurting.
It's just around there.
Okay,
Oh,
alright.
Okay.
You feel like you're going to be
Pop
sick?
this on your finger, my dear.
no. I don't know.
Okay. Can we get a temperature, please? Is that
Yeah,
okay?
absolutely.
Alright. That's just looking at your heart rate,
All right.
baby.
It's okay, my
just
dear.
leave that on if that's alright.
Oh, no, can we stay in bed, my love?
What's this?
Oh,
What's
careful.
this?
Oh,
That's
okay.
pulling a bit.
Beaver, look at me. Look at me.
Yeah.
I'm one of the doctors.
Yeah.
So your temperature is 37.
37. Try and leave this here, alright?
Oh.
What I'm going to do is,
Oh.
before we go any further, can you prescribe us some morphine? Is that alright? Can you prescribe some morphine? Just check renal function. Can you prescribe 5 milligrams of morphine? If that's alright.
Okay.
And you can give it oral's fine for now.
I'm going on. I'm going on.
Okay. Beaver, can you listen to me?
Yeah.
Do you want to get the pain under control before we go any further?
Oh, yes, yeah.
Can I get one of my other doctors?
I'll have a cup of tea, love.
Oh,
Biscuit.
I couldn't see the biscuit. We can get you that, but should we also get you some pain relief? It'll make you feel a lot better. Okay, well, we're sorting that. Can I do a quick assessment of you?
What do you want now?
Can you sit up for me, please?
Do you need anything else from me,
Just a
doctor?
stethoscope,
Or do you need
please.
a stethoscope? I can grab that for you.
Let's work our way down through the ATE. Thank you.
I mean, I know that you mentioned morphine, but I'm a bit worried because she's really not passed much urine at all.
Yeah, so that's
I'm
why I
worried
said
about
check the
her
renal
kidneys.
function. Yeah.
So she hasn't got any renal functions done.
No, okay.
She's just got FBC. So
Okay.
I think the bloods,
Let's just give some paracetamol
I
for
mean, the
now.
bloods were done
Just
this
give some more
morning, I'm pretty
paracetamol for
sure.
now. Yeah.
it's just a full blood count. We need renal function.
Baby, can I
tests as
listen to
well.
your chest?
Okay.
Oh, if you want to. Oh, that's cold.
Okay, so there's nothing. I can do some bloods if you'd like. Yeah.
And then we'll start her on some paracetamol.
Okay, that's fine.
I know it might be a bit uncomfortable, but can you sit forward for me?
You want me to do
Do you
what?
know
Can
which
you
bloods
sit
that you'd
forward
like me
for
to
me?
do?
I'm very
full
sorry.
blood count,
Okay.
urine electrolytes,
I'm just going to feel your back. Any pain when I'm pressing here?
Let's do a
Sorry
back
there. Can I
tape
press the
case
other
as
side?
Well.
Okay.
Any pain here?
And if you could
Okay.
do a VBG as
All right, I do
well.
really
Okay.
I'm not
So you want me to do full blood count using these LFT, CRP, getting a, what was the other one?
VBG.
BBG. Okay.
Thank you so much.
No problem.
Oh, where am I? I don't know where am I.
Okay.
Okay.
Any pain here?
Yeah, it doesn't look like the using needs have been done, so we're going to take some extra bloods, okay, Beaver?
Okay, I'm pressing
Is
on the
that
bladder.
okay, my dear?
Does it feel distended at all?
I think it might be as you feel it.
I have a feeling.
Yeah.
Okay, it's fine. Okay. That's fine. All right.
Sorry, do we know how much she weighs?
Not off the top of my
More
head,
than
sorry,
50
but we can...
kilograms, let's
Okay.
say, for now.
Right, I'm going to take some bloods, okay, my dear? Sorry, my love, it's going to be a little bit... It's just...
You do it to me.
Sorry.
It's just
Touching
a
me.
little bracelet, okay? It's just like a little
My
bracelet.
nursing colleague's just going to take some bloods. Please can you do some cultures as well? Is that okay?
I can, it'll just take me a second while I grab the
Just
bottles.
something if this is sort of a polynephrititis, potentially.
Yeah.
Okay. The obs, what are we looking at? So
Okay.
pulse is high, sats are high.
Yeah. I think the heart rate should be on there as well. I think it's probably a little bit. Oh, it's there.
Can I look at?
Oh,
Okay.
sorry. I'm going to be really quick, okay?
Is there no obvious sort of fall in hospital or anything that we know of?
Okay.
No. Okay. Blood pressure's fine. We're not going to do anything yet. Can we get a lactate as well? Would that be okay?
Yes, that's fine. I think your colleague asked for the lactate as well, so that's fine.
So she's not passed much urine.
No, I think only 20 mils in the
Yeah.
past 2 hours really is what
Past
she's
2 hours.
passed.
Okay. We'll wait for the blood to come back, but in the meantime, are we okay to give 1 litre of saline over sort of 3 hours at least? Is that okay?
Okay, I can do
I
that.
just give heart failure or anything.
Should we get a bladder scan as well?
So I've palpated the bladder, doesn't feel distended, but we can get a bladder scan. I think that's a good idea.
Okay, no problem. I can get that ready. It'll take us a little bit to get that
Okay,
ready. It's on a
thank
different
you.
ward.
All right. In terms of the catheter, do we think it could be blocked? Could we try flushing it?
Pardon? Sorry.
Could we try flushing the catheter?
I can try flashing it.
Is that okay?
Okay.
Yeah, as well. Okay, let's go for immediate things that we can see. Do we have any other, Trish, do you have any other differentials that you're thinking at the minute?
Okay, so
She's had previous UTIs
can
before.
you just give me a
She's
minute and I'll just do some stuff with the patient if that's
I'll let
okay.
you- Let's talk here.
Yeah.
Um,
So she's had previous UTIs before, previous kidney stones. I'm thinking, could it be an AKI possibly?
she should be AKI, she could be not responding to the treatment.
Yeah.
She could have false passage catheter or something hydronephrosis. Let's let the
Yeah.
bladder scan.
Yeah.
Okay, I'm just going to do a quick scan of your bladder, okay?
That's cool.
It's going to take us a few minutes.
Yeah.
I know, I'm sorry.
Oh,
Sorry,
anyway.
She's on lisinopril, simvastatin.
This job is going to be a little bit cold, okay?
Oh, yeah,
Which one,
That's
Oh.
Parkinson.
Just be a few
Okay.
more minutes, my dear.
I'll just answer this.
You're doing really well.
Hello, it's biochemistry lab. Did somebody rang about some blood results for one of your patients? The system's down, so things haven't been coming through properly. I've got
No
a bit
worries.
of abovia.
Yes,
Lovely. And U's and E's, is that what they were after?
yes, that's what we're looking for.
Lovely. So urea's 13.
Mhm.
Creatinine's 244. Sodium's 143. Potassium's 5.1. A bicarb 17. Is there anything else you'd like?
Does she have a CRP on there as well?
Yeah, CRP is 68.
And her white cell count?
White cell count. Just give me 2 seconds. I'll have to open up that page. White cell count's 13.5.
Sorry, could you just repeat that? I'm just going to
White
make
cell
a note of
count's
it.
13.5.
White cell count is 13.5 and
Yeah.
the CRP was
68.
68. And the urea was 13,
Urea's 13. Creatinine's 244.
244.
Okay, is there anything else?
And do we have an EGFR on her?
25.
25. All right.
Lovely.
And potassium as well was
Potassium was 5.1.
5.1. Thank you.
Thank you. They should be on the system soon.
Thanks. Bye.
Blood's on the KPR investigations.
She's had.
Hiya, was that just a call that we
That
got?
was just a
the
call
lab.
from biochemistry.
Okay.
We got some of the bloods back.
All right.
She does look like she is in an AKI. Her
Oh,
urea
right.
and creatinine are quite high.
Okay.
It also looks like she has an infection as well.
Okay.
Her white cells are 83.
Okay.
Her CRP is 83, and her white cell count is also high.
Okay.
Is she on it?
So what would you like me to do? Is there anything particular you need me to do? I'm a bit worried about her. She's really quite...
Yeah.
Does
Quite
she
out of
have
it.
a temperature?
She didn't when I checked it just a few minutes ago now.
Okay.
I'm just going to go back and I'm going to read you my AT assessment, make sure that we're not going down the wrong route. was sort of real. In the meantime, can you see if she's done antibiotic and find
Yeah.
something appropriate to prescribe?
And I'll stop the nephrotoxic drugs as well.
Yes,
just for
please stop
now.
anything. Stop the
Yeah, the
insulin.
statins
Yeah.
and
Okay, and you
things.
said you wanted me to get those fluids done as well, didn't
Yes. Just before that, just for the fluids, am I able to get an ECG and a repeat of blood
you? Yeah, I
pressure?
think we're doing the ECG at the minute.
Okay. Fine. Sorry.
Oh man. You okay? What's going on? They keep
Right, I
touching
think this is
us.
our
What's
ECG.
going on? Oh no, you're
Thank you.
what's going on?
Hello.
Okay,
Was it
man.
the 3 hours for the fluid that you wanted?
Yes, please.
You look horrendous.
Hi, babe. Sorry, can I speak to you for 1 minute just
Yeah,
at the side?
yeah.
Is that okay? Just, babe, can I speak to your daughter for a sec? Do you want to come with me?
Sorry,
for a
I
sec?
don't want to stand.
No. Okay. Your mum. Sorry, my name's Mardy. I'm one of the doctors.
Yeah.
Your mum's in a bit of pain at the minute.
Has she had a meds today?
Baby, my
We're
dear.
sorting her meds out now.
I'm just getting
What I'd
my
ask
on.
if it's
just
okay,
some fluid,
just
my
while
dear.
she's a bit poorly, if we could just get a bit of time as a medical team to see what we can do for her and make her feel a bit better, and then can I get you to wait in the waiting
I
room?
know, I can't leave her looking like this.
Okay.
Look, she's so distressed.
Alright.
You alright there,
I
Mum?
appreciate that.
Have you had your medication today?
I don't know.
You had your Medipar?
Okay.
I want to go home.
I know you did. I know.
Alright.
Has she had a Medipar today?
I can have a check on the system. I'll
Yeah,
just
I mean-
check quickly.
I appreciate the time critical medication, but I don't know if it'd make her look
7
like this.
p.m. It's 7 p.m. at the minute. Can we
Yeah.
just check if she's had a
Sure.
most recent meds, if that's okay with her?
Yeah.
The doctor says she's in pain. Where's it?
So
Come back hurt.
she looks like she's had her
Just start
pamapexole
it back on
this
the
morning, her
Can I get your
Matapar this
name?
morning.
Charlotte,
Charlotte, sorry
has she
about
meant
you,
to have it
Charlotte.
all of
We're
those
just having a
days?
look at
Because
the
she hasn't had
medications
any
now.
this
We're just going
afternoon
to give her
then.
some antibiotics and some fluid.
Does
I
it look
appreciate
like?
your mum
If
does
she's meant to have it all of those
Parkinson's disease.
times. I mean, we've only given
My
it this
immediate
one
thought
and
would be
it's kind of evening
appreciate
time
some of these
now.
are really time critical
So it looks
medications.
like she might have
I'm
7
not sure if it
p.m.
would
Yeah, she
cause
actually
back
hasn't-
pain in this way. If that makes sense.
I mean, I'm not a doctor.
Yeah,
You're a doctor, so
okay.
I mean, I don't know what would cause back pain.
So I think we need to just go through things just a bit systematically.
Yeah.
So is that alright?
I mean that's fine. But my question is, has she had them? Because this seems to be an issue every day I come in that she hasn't had them. They've been
Okay.
late, and then when she doesn't have them
Yeah.
and they're late, she
appreciate
ends
that.
up deteriorating, and
Yeah.
it's every time she's in hospital we have the same.
Yeah.
I have the same conversations. I
Okay.
speak to the nursing team, I speak to the medical team.
Hello, love. How long you been here?
I've
Okay.
only just got here, Mum. I've only just got here trying to speak to the doctor to check and see if you had your Parkinson's meds today.
She had a bug.
So she's
Sorry.
had
So it'll be 1 minute, sorry.
she's had them this morning,
Yeah.
but she hasn't had the rest of the other
Okay.
3
You better get
doses.
you home.
So alright. So we need to give
one-
her a stat of
Matapar
Matapar
and
and
whatever.
what time is there a specific time written?
There's
the
no
time
specific
critical?
time
No.
written.
Okay. So we
So we'll
okay.
give those two
Give a stat of both.
and stop these for now.
Stop those for now, but I think she's got some sort of unusual arm movements, whether it's Parkinsonism. It's difficult to assess with the daughter being there.
Yeah.
So let's give a stat of these two now, and then we'll reassess and go from there. So I appreciate you.
She comes in for antibiotics. She don't end up giving her meds. She ends up deteriorating. And I have these conversations time and time again. Has she had them?
So if it's alright, I'll just go this way. So I've just got one of the other doctors, Trish, to have a look on the computer. So the morning doses were given.
Okay.
I am very sorry, and I appreciate you say this has been a recurring theme, and so we'll definitely look into this. They haven't been given for, I think, 2 or 3 doses. We're going to give some doses now.
Does he have a set dose of the Matapar?
I understand. I entirely
I
understand.
appreciate it's
Yeah.
not you and
Yeah.
thank you. You're not the one giving her medications, but it's just not good enough.
It's absolutely not.
She's been in hospital quite a few times with water infections. At home, so regimental with
for now.
medication. She has a
Absolutely.
waste all the time.
Investigating.
And she comes in for a water infection, she's confused at home, she gets some antibiotics,
Yeah.
but while she's in here, she doesn't get her meds properly and she just ends up deteriorating. And time and time again, this has happened, and I feel like I'm just speaking to a brick wall.
Yeah. So we have some really good Parkinson's nurses who watch this like a hawk. So what I'm going to do is I'm going to make sure she's on the radar of the Parkinson's nurses. After we've dealt with this acute event, we will fill out incident reports and I will let management know immediately. Okay.
And I know it's not you,
Yeah.
right? And I'm just.
No, I entirely understand your
frustrated
frustration.
Because
Yeah.
every time I speak to the nursing team, I stress how important it is. And I know you're busy, I know you've got a lot of patients. This matters, and it's just not good enough. This was your mum.
Yeah. No, I completely understand.
Yeah.
Okay.
Yeah.
Alright.
You haven't had your meds again today, mum.
So what I'll do is I'll just get this medicine sorted for you straight away
Right.
for your mum.
Yeah.
Then let's go from there and I'll talk to your mum in a minute. Is that alright? Okay. I'm sorry for this. I'll be happy to give a stat of each. There's no sort of obvious reason why we can't. I've explained to the daughter. I'll sit down with the patient in a minute. After we give that, I will talk to MedReg. I'm trying to think of sort of can you get sort of a little Parkinsonian crisis type thing. Can you think of anything off the top of your head?
Do you want to try some medication? Okay.
I
Okay.
can't think
Okay.
of anything. I would just personally call the MedReg and then see if she would advise anything else.
Okay.
And then I'll prescribe the antibiotic as well.
So let's do this, and then the antibiotics. The fluid's running now. She could have sort of pyelonephritis. With bladder scan, I need to ask what that is. Let's think of sort of obvious things first and work backwards. The ECG is sounds tacky.
If we're thinking kidney stones, if we want to rule that out, we could do a ultrasound
We
kidney.
could
but that
consider that later on.
be a later
As
thing.
a later thing. Sort of she's got quite bad flank pain.
Yeah.
What was the bladder scan result?
The bladder scan results, I think I'm just still waiting on it at the minute.
Okay,
But I can let you know in a few minutes. I'll just double check.
fine. Okay. Alright, so the ECG is sinus tachy. She's in pain. We've given paracetamol, is that right?
Yeah.
Prescribed paracetamol.
Prescribed that.
And have you given the Parkinson medication? Is that
Yeah.
okay?
So we've kind of given the paracetamol, some fluids, some Parkinson's.
Yeah.
I mean, what's the plan kind
Okay.
of from
The
here?
plan, let's give some antibiotics, antibiotics for, go for at least pyelonephritis,
Okay.
because she's got flank pain.
So we think it's
It
pyelonephritis.
could be pyelonephritis. She doesn't have a fever. I'm
Okay.
trying to think, is there any sort of unusual
I mean, she
Parkinsonian?
has had kidney stones before. Do you think it could
Yeah.
be that?
Could be.
It could be that. In the immediate setting, I can't magic them out. It sort of would have to get a later ultrasound or CTKUB.
Right. But you
I
want to
see.
treat as pyelonephritis for now.
Let's give an antibiotic for now. She's got raised white cells. She's got an AKI. Let's give something for now. In terms of kidney stones, she wouldn't get no urine output at all, I'm thinking. So, unless it's sort of in a really,
Okay.
she's got sort of bilateral stones causing an issue, she'd have hopefully one kidney working. Is there anything you think I'm missing, Trish?
No, that sounds like a
Yeah.
good plan.
It's just
for
difficult
now.
to examine her